Hi everyone, this is Tom, and in this video I want to talk about the strategy I suggest you use for studying anatomy. And this is what I used in my first couple of years of medical school. I did pretty well in anatomy, and I've tweaked it so that it's even more effective now, putting into practice all the principles we talk about on this channel. So anatomy is tricky. Obviously, this is for medical students, but it could apply to surgical trainees, physios, anyone who wants to learn anatomy for exams. So let's start by looking at what do you need? So what do you need to know to do well in your anatomy exams and to have a useful working knowledge of anatomy so that you can do your job, whether that's being a physio, a surgeon, anyone who uses anatomy on a daily basis. So firstly, you need to know the basic structures. So you need to know, which muscle is this, which nerve is this, which blood vessel is this, which lymphatic vessel is this, which landmark is this, and so on. You need to know their names, and you need to be able to identify them. So have their appearance and their location. So if I point to a muscle on an anatomy diagram or a cadaver or a person, you need to be able to sort of name that and see what that muscle is. Second thing is you need to know what's the relation to other structures. So what do I mean by this? Well, for example, if it's a muscle, it would be like the insertion point. So where does that muscle insert into the bone? If it's a muscle or any kind of organ, what's the innervation? So what nerve supplies that? What nerve supplies that muscle or organ? And what's the blood supply? And if it's something like a nerve or an artery, what vessels or nerves or arteries become that? So what's the kind of journey of that through the body? So where's the origin? Where does it split? So how does that thing travels through the body? What structures does it pass through? What different names does it have along the way? Then next thing is, what is the physiology or the function? So for example, basically, what does it do? So with a muscle, let's say you've got the deltoid muscle, that abducts the humerus at the shoulder. So you want to know the function of that muscle or that blood vessel or that organ. And then finally, number 4 is kind of clinical relevance. So when I say clinical relevance, this is like what can go wrong, and how might it present? What symptoms does somebody have if there's a problem with that structure? When might the structure be damaged in surgery? That kind of stuff. Okay, so let's look at how do we learn all of these things? Well, the first step is break it into topics. So you can't just sit down and learn all of anatomy all in one go. You have to break it into topics. This is going to take you months to learn all of anatomy. And there's no way you can sort of cram all of anatomy into a day or two. There's just too much to learn. So you want to break it into topics, and each topic is something that you can study in, say, 1 to 3 hours. So a single study session where you sit down, you really get into it, and you study that topic, that section of the body, or that system in 1 to 3 hours. And so, for example, you could break it down into, say, anatomy of the head and neck, anatomy of the thorax, anatomy of the upper limb, etc. Or you could break this down into, say, systems. So you say the muscles, nerves, arteries, etc. And you'll probably find your course or your university already kind of splits these up a bit for you. So they'll say, this week we're doing the upper limb or the shoulder. This week we're doing the organs in the abdomen. And you could split it, the topics, according to what your university, how they kind of organize it. Or if you've got a resource, say some flashcards or some textbook, you might find that that's already split it into topics for you. So you can just go with what they go for. And for each topic, to get the most out of it, you need several things. What I recommend is flashcards. And there's loads of different anatomy flashcards. If you go on Amazon or anywhere, you can find lots of different anatomy flashcards. I desperately want to create a set for 0 to finals, but that's going to take a long time and a lot of works. And I've got other stuff on at the minute. But you can already buy loads of flashcards. For this kind of demonstration, I'm going to show you me kind of going through some flashcards. And I've just got these Grey's Anatomy flashcards, which are okay, they're not too bad, but there's loads of different ones available. Ideally, you also have some short answer questions. And then you have some notes or some reading material that talks about the function and how things work. So for the flashcards, what you're looking at is the basic structure. So you're identifying the names, locations, and appearance. And then for the notes, that's what goes into relation to other structures, physiology and function, and clinical relevance. So you're actually learning about that structure. So with the flashcards, you say, this is the deltoid. For the notes, you say, this is the deltoid's action, innervation, the blood vessels, etc. And then you have some kind of exam practice. And you want this to be as close to your exam as possible. So for a medical student, this might be, for example, multiple choice questions if you've got MCQ exams, or if you're doing like MRCS, something like that. Or if you're going to be in an OSCE scenario where an OSCE examiner's got, say, a cadaver and they're going to be pointing to structures, asking you questions, you want to practice as close to that scenario as possible. So find somebody else, like somebody on your course, and you can test each other just like that in this bit. So then, what is the structure of a study session? A single study session. And if you're familiar with my content, you'll know I preach this thing called a testing sandwich. And you apply this again to learning anatomy. So you get to the library and you're going to spend the next 3 hours learning the anatomy of the upper limbs. I'm going to go through a kind of demonstration of this. The first thing you do when you arrive, you're completely cold, you've got coffee, but you haven't started doing any studying yet. You've got all your material on the upper limb and you're going to go through that in a study session. First thing you do is you go through your flashcards and your short answer questions. And you kind of mark yourself as you go through that. So let's kind of demonstrate what I mean. So these are flashcards by Grey's Anatomy, and they're okay, but we're going to start with this flashcard on the upper limb. And we're going to go through and look at we're going to test ourselves on this content. So let's start with, we got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15 different topics. 15 different things on here. So let's start with the ones that we can identify. So we'll start, say, at the number 1. This looks like the insertion of the deltoid muscle. Number 2 looks like, I'm going to say, the teres minor muscle. Number 3 is the humerus. Number 4, I'm not really sure what that is. That looks like the insertion of the teres major. Number 5 is some kind of space. I don't know what that is, what space that is. Number 6 is some kind of space. Number 7 looks like a tricep. And number 8 is the olecranon. Number 9 is again the tricep muscle. Number 10 looks like the teres major. Number 11 is something I don't know, another space. Number 12 is the infraspinatus, I'm guessing. Number 13, I have no idea what that is. Looks like the insertion of the trapezius. Number 14, is this the supraspinatus? And number 15, I don't know. So then we go through and we check. Number 1 is the cut edge of the deltoid. So yeah. Number 2 is the teres minor muscle. Number 3 is the surgical neck. So this is surgical neck. So we'll get this wrong. Number 4 is medial lip of intertubercular sulcus, anterior on the humerus. So this is the intertubercular sulcus. Intertubercular sulcus. So then we think, what does this mean? Tubercular. So this will be some kind of tubercles on the humerus, and it'll be the intertubercular sulcus. So sulcus is kind of like a dip. Okay. And that's anterior on the humerus. Fine. Number 5 we didn't know. That was the quadrangular space. Okay, so it's got 4 sides, quadrangular space, and that's between the teres minor and the teres major. Quadrangular space. Okay. Number 6 is the triangular interval. Okay, so it is a triangle. So is 11. What's 11? Triangular space. Okay, that's confusing. So you've got the triangular interval and the triangular space. Okay, we got that wrong as well. Number 7 is the triceps brachii. So with 2 eyes, triceps brachii, and it's the lateral head. I'm not going to give myself that one. Number 8 is the olecranon. Number 9 is the triceps. Again, this is the long head. So there's a lateral head and then a long head. I need to remember those. And then the infraspinatus, yeah. Cut edge of the trapezius, yeah. Supraspinatus, and this is the suprascapular notch. Was number 15. Suprascapular notch, all the way down there. Okay. Scapular notch. So, in the study session, here's what you would do. You would take these cards, and these are form part of your topic. So these are all the flashcards on the topic you're studying, and you go through all of these cards, listing them. So here I scored 1, 2, 3, 4, 5, 6, 7 out of 15. So that's my score. I need to remember this 7 out of 15. I'm going to record that later, and I'll talk about recording it later. And then what you do, when you've finished going through the flashcards, I would then go back to the first flashcard and try it again. And this time, again, you're looking at 1, the deltoid, but I would just do the ones that you couldn't remember. So I got this one, quadratus. This was, what was it? Number 4, quadrangular space. Okay. So this way I'm trying to recall the information, recall it from memory, and then I'm filling in gaps when I can't remember it. So what else did I get wrong? This was the neck, the surgical neck of the humerus. This was the lateral head of the triceps. This was the long head of the triceps. What else did I get wrong? This was the supraspinatus notch, I think it was, number 15. Suprascapular notch. Okay, suprascapular notch. Anything else I got wrong? This was the triangular space. This was the triangular interval. And I think I've got everything else right. So again, I'm trying to go back to those things that I forgot, I didn't remember, and test myself on them again. The more times you recall it, the more you'll remember it. So you can keep going through these flashcards until you're getting most of them correct. And then you go through some short answer questions. So on the computer here, I have some short answer questions. So first question, name the 4 muscles that make up the rotator cuff. So they are the teres, shall we say major, subscapularis, infraspinatus, and the supraspinatus. And then you go to number 2, which is what is the primary action of the deltoid's middle fibers? So the lateral middle deltoid is abducts the humerus. Number 3, which nerve innervates the serratus anterior and what clinical sign is associated with its injury? Serratus anterior, I have no idea. Let's say the axillary nerve. And I don't know what the clinical sign is. And then 4 is what's the origin of the subscapularis muscle? I have no idea. Origin of the subscapularis, should we say the humerus? I don't know. So then we look and we check our answers. So the answer is supraspinatus, infraspinatus, subscapularis, and teres minor. That's the teres minor. The teres major is not a rotator cuff muscle. Then we've got abduction of the shoulder. Correct? The answer is the long thoracic nerve. Okay, so the serratus anterior is from the long thoracic nerve. And it causes a winged scapula. I need to remember, winged scapula. So the serratus anterior, there's a long thoracic nerve. And the serratus, if it's weak, the scapula's wing out. What is the origin of the subscapularis muscle? The subscapular fossa. Okay, so that's wrong. Subscapular fossa is where the subscapularis comes from. Okay, so now we can add up our scores. 1, 2, 3, 4 out of 7 possible scores. So our score on the flashcards was 7 out of 15, and short answer questions was 4 out of 7. So now, in our study session, we've completed our flashcards and our short answer questions. Now we move on to the next step, which is read and recall. So, read and recall, if you've been through it with me before, it basically involves covering everything up and then recalling as much as you can remember. For anatomy, because we've been through the flashcards and we've been through some short answer questions, we can do some recall, but we could be here for a long time. So before you even open the book or your notes, you would stop and try and recall as much as you can. So you could say the muscles in the shoulder. Let's try and recall all those muscles from memory. So we've got the deltoid, we got rotator cuff muscles, and they are the teres minor, subscapularis, infraspinatus, and the supraspinatus. So you can see I'm struggling and I'm recalling as much as I can from memory. This is how you write content to your memory. This is how you store memories, is you struggle to recall that memory. And then, so what else can we think of here? I can remember the deltoid is the axillary nerve. There's also that serratus. Anterior was the long thoracic nerve. I need to remember that. There's a couple of triangles in the shoulder. There was the triangular space, triangular interval. Then there was the quadrangular space. What else to remember? Okay, I've kind of reached the limit. Now we open the book. And what we do is we start by, we've got all these notes on this topic. And we're going to start by scrolling up very slowly. You can do this from physical notes by moving a piece of paper down, only revealing the titles. So here we've got rotator cuff muscles. We've been through those a few times. What's the function of the rotator cuff? Okay, let's test ourselves. Function of the rotator cuff. So now I think to myself, before I even look at the answer to that, I'm thinking, what's the function of the rotator cuff? Well, it's to kind of stabilize the shoulder joint, keep the humerus in place. Okay, stabilize glenohumeral joint and rotate the humerus. Okay, so it is stabilize the joint and rotate the humerus. Okay, so if the bone is down, the muscles will rotate it like this. So what's the mnemonic sits? Okay, that's useful to remember. Okay, so let's have a look. We've got muscle, origin, insertion, action, innervation, blood supply. So again, I'm going to start testing myself. I've not looked at any of these yet. So supraspinatus, then we could cover that up. The origin of the supraspinatus. What's the origin? Supraspinatus, supraspinous fossa on the scapula. So the supraspinous fossa on the scapula is where the supraspinatus comes from. What's the insertion? On the humerus, it'd be the greater tubercle. Okay, what's the action of the supraspinatus? Is it internal rotation or external rotation of the humerus? Let's have a look. It's actually abduction. Okay, supraspinatus at the top, above the spine of the scapula, works to abduct the shoulder. Okay. What's the innervation of the supraspinatus? Is it the axillary nerve as well? No, it's the suprascapular nerve. Okay, and then the suprascapular artery. And so you get the idea. You go through trying to recall everything first, then looking at your notes and finding out the answer. Recalling is how you store information in your memory. It's not, you don't store information by reading it, you store it by recalling it. Okay, so that's how you do read and recall. That's how you get through all your written content, constantly testing yourself, constantly trying to recall the answer, then looking at the answer, and then kind of processing it and thinking about it. And then later on, you would go back and try and recall the key things that you knew you needed to remember. So you've done your read and recall. The next thing in this testing sandwich is that you move on to some kind of exam practice. So at this point, we're going to go through some multiple choice questions. So it could be a multiple choice question exam, or it could be an OSCE type exam. If it's an OSCE type exam, get together with a friend and test each other on that content. So let's do some practice multiple choice questions. So here we have some multiple choice questions. So we're going to go through just like we would do like a multiple choice question exam. So question 1, the idea of these multiple choice questions is that they get you to apply the information that you've just learned in an exam setting. So if you're doing a practice OSCE, you would be applying the information you just learned in an OSCE type setting and practicing what you would do in the OSCE. So here I'm practicing what I would do in a multiple choice question exam, but do OSCE practice if that's what your exam is going to be on. So a patient presents with weakness in shoulder abduction and numbness over the lateral shoulder. Which nerve is most likely to be injured? So this sounds like deltoid weakness and numbness. We're going to say the axillary nerve, as this is related to, you can have this with shoulder dislocations where the axillary nerve is damaged. You get this, I think they call it Reginald's patch or something like that. So this is like something in my memory. Number 2, which muscle is responsible for both adduction and internal rotation of the humerus? Let's go with adduction. So pectoralis major, posterior deltoid, serratus anterior, rhomboid minor. So imagine you've been through this, you've studied it just now. So you remember that the pec major does that. Number 3, a patient has wing scapula, likely has an injury to which nerve? So remember, this was the serratus anterior muscle, and we did this in our short answer questions, and it was the long thoracic nerve. So that's C. So axillary nerve was B, pec major was A. And then final question, which of the following muscles is not part of the rotator cuff? This is a mistake we made early on, and that was B, teres major is not part of the rotator cuff. So let's check the answers. Axillary nerve, pec major, long thoracic nerve, and teres major. So that's 4 out of 4 on the MCQs. Okay, so that's a demonstration of what you would do in a study session. So you start with flashcards and short answer questions, then do read and recall, then do your practice exam. And you'll notice the whole way through, I'm constantly trying to recall the information. None of this is passive. None of it is just absorbing information. All of it is quite strenuous and hurts your brain, hurts your memory. You have to think hard. You feel a bit silly because you sometimes don't remember things. But what happens is you identify gaps in your knowledge, and it's actually the recall and the strain and the stress that causes you to store that information long term. So that's a testing sandwich. What's the next thing? We need to go through what's your learning schedule. So we've looked at what you do during a study session, which is the testing sandwich, but how do you organize your study sessions? Well, an essential thing is you need spaced repetitions. So you've got this timeline. So this is now, and this is your exam. So you need to, because one study session of a topic is not enough, and you're going to forget almost everything you learned within a few days, no matter how good you study. You need to repeatedly study the information 2 to 5 times before your exams, depending on how hard you find it. So let's say you do this topic, you do the upper limb, and you cover the whole of the upper limb, and you do that now. Well, you're going to have to repeat that again at spaced intervals. So you do the topic 1 again here in, say, 10 days time, and then you do topic 1 again here in, say, 4 weeks time, and then you have your exam. Between repetitions of topic 1, you would do topic 2, here, topic 2 again, topic 2 again, here, and so on. And then you'd have like topic 3 that you add in, and topic 4, and so on. And so you're doing spaced repetitions with different topics in between. The next thing you need to do is track your learning. So what are you tracking here? Well, you're tracking several things. Firstly, the date of your study session. So if you did the shoulder today, you would put today's date in your tracking tool, your tracking system, or tracking table. Then I would add confidence on that topic. So low, medium, high, just keep it really simple. And then I would add in your initial flashcard and SAQ scores. And then the final thing is your MCQ or your OSCE practice scores. So when you're tracking, you can look back and say, I did topic 1 2 weeks ago. I had low confidence. I scored 30% on my flashcards and 60% on my multiple choice questions. And then you can do that again today and see how your confidence and your scores are increasing over time. And then the final thing is 1 to 2 weeks before your exam. At this point, I wouldn't do the full process. So this is quite a lengthy process. It's taken me here, doing some of this with you has taken sort of 20 minutes or so. But if you're going to do the whole topic, it's going to take you a lot longer, like 2-3 hours. But in the 1 to 2 weeks before your exam, you should already have a really good foundation of knowledge. And at this point, all you need to do is rapid testing. So this is just ensuring that the whole lot of information that you need for your exam is right at your fingertips, really fresh in your memory. So this would just be just doing flashcards, just doing practice MCQs, just doing practice short answer questions, just doing practice OSCE, testing with your friends, just testing each other. So this is just rapid testing to keep everything really fresh and ready for your exams. And that's pretty much how you learn anatomy. That's the end of this video. That's me kind of covering the whole of anatomy. If you want to download a really nice sort of clean version of the notes that I've been making over here, you can download those on the Zero to Finals Patreon. There's a link to that in the video description. And I hope you join us for the next video, which will be tomorrow.